In this video, let us discuss pharmacotherapy of cough. We all know that cough is a protective reflex that is intended to remove irritants and accumulated secretions from respiratory passages, that is in the nose and pharynx. Let's discuss types of cough. Cough is of two types: productive cough and non-productive cough. Productive coughs helps in removal of irritants so that airway is cleared. Suppression of productive cough is harmful as it may lead to infections due to the accumulated irritants. Antibiotics and expectorants and mucolytics are used in the treatment of productive cough, whereas for non-productive cough, it can be suppressed. Classification of drugs in the symptomatic treatment of cough. They are antitussives, pharyngeal demulcents, expectorants, and mucolytics. Antitussives include codeine, folcodeine, noscapine, dextromethorphan, prenoxdiazine, chlorpheniramine, and antihistamines. Pharyngeal demulcents include lozenges, syrups, and licorice. Expectorants include sodium and potassium citrate, potassium ionate, ammonium chloride, and guanfacine. Mucolytics include bromhexine, acetylcysteine, carbocysteine, and ambroxol. Let's discuss each of the drugs by their mechanism of action and their adverse effects. Antitussives. They inhibit cough reflex by suppressing cough center in medulla. They are used in the symptomatic treatment of dry and unproductive cough. They are mostly avoided in children less than 1 year of age. Antitussives include codeine. Let's see codeine. Codeine suppresses cough center, so it has cough center suppressant effect. It has mild CNS depression, so when we take it, we feel drowsy, and it causes constipation by decreasing intestinal movements, so it can be used in diarrhea also. It is given orally and it has mild analgesic effect, and it has less addiction liability than morphine. Morphine has more addiction liability. Avoided in children and in asthmatics. Next, folcodeine. It has same mechanism of action like that of codeine, but it doesn't have analgesic and addiction liability. It is taken orally and has long duration of action. Noscapine is an opium alkaloid and it is a potent antitussive effect. It has no analgesic effect and no constipation or addiction and CNS depression like that of codeine. So it is used in the treatment of spasmodic cough, but it has few adverse effects like nausea, headache, and it may precipitate bronchospasm in asthmatics. Dextromethorphan. It is a centrally acting antitussive that inhibits cough center in medulla. It has no analgesic effect, no addiction effect, and no constipation. But it has adverse effects like sedations and hallucinations. Mucociliary function in respiratory system is not affected. Let's see antihistamines. Antihistamines are used in the symptomatic relief of cold, cough associated with allergic conditions. They usually cause inhibit release of histamines from the mast cells due to degranulation. They commonly include diphenhydramine, chlorpheniramine, and promethazine. These are all our first generation antihistamines. They are sedative, anti-allergic, and anticholinergic. Prenoxdiazine. It acts peripherally on stretch receptors of airways so that the cough is suppressed. Pharyngeal demulcents are the drugs which are used to treat cough that is arising due to irritation or above larynx. They include syrups, lozenges, linctors, and licorice. They generally cause increased salivation and produce productive soothing effect on inflamed mucosa of pharynx. Lozenges are solid dosage forms placed in mouth and sucked. They soothe irritated mucosa of throat. Lozenges include diclonine, which is a local anesthetic for treatment of sore throat. Lincoln I codeine is viscous fluid. Expectorants. These are also known as mucokinetics, since they increase volume of bronchial secretion and decrease viscosity of sputum, so that there will be no any blockage in the respiratory pathway, and that the decreasing of viscosity results in less tiring and productive release of sputum out of a respiratory pathway. They includes iodides, chlorates, bicarbonates, acetates, and volatile oil. Mucolytics. They generally cause breakdown of thick tachyneous sputum that lowers viscosity of sputum, which results in thick, thin sputum, that is watery sputum, which can be expelled out easily. Mucolytics include bromhexane. It is a semi-synthetic agent that is used orally. It is a potent mucokinetic and mucolytic agent. Bromhexane liberates some lysosomal enzymes that digest mucopolysaccharides, which results in decreased viscosity of sputum and causes less tiring during cough, and it is productive. Adverse effects of bromhexane include rhinorrhea and lacrimation. Next, acetylcysteine and carbocysteine are mucolytics used as aerosols in the treatment. Carbocysteine is used orally and causes gastric irritation, so avoided in peptic ulcer patients.